Another treatment for dentistry from the dental world for CPAP is to wear an orthotic in your mouth. And that makes your mouth bigger so the tongue has more room, or it pulls your lower jaw forward, pulling your tongue out of your throat, and that helps you get a better airway and you have better sleep, okay? Now, some folks do that in combination. They have a dental orthotic that pulls their jaw forward, and they use a CPAP, but they also can turn their CPAP pressure down. Because for some people, the pressure gets so high, they can't stand it, okay? And so it's like, well, I need the pressure this high, but I can't sleep with it that high, okay? Now, you're a good patient. You have, and give you applause, okay? You're using your CPAP. 80% of people that have been prescribed a CPAP are not using it, okay? So the dental orthotic for a lot of patients is a solution that will help them, which is better than nothing. It may not be quite as good as the CPAP was as a solution for this nighttime problem, but it's better than nothing, okay? Now, the other possibility, so in both these cases, whether it's a dental orthotic or a CPAP machine, this is a treatment to help you to get through this difficult time during sleep, okay? Neither of those techniques or therapies are doing anything to help you breathe during the day, okay? So if we want to help be breathing better through the day, then we need to learn to put our tongue in the roof of our mouth, keep it there. We need to practice nasal breathing. We need to maybe also practice not sucking so much air in and sucking air in with less frequency, okay? If you were to go back and look at the medical texts 100 years ago, the textbook said we as a people breathed 6 to 12 times a minute. Today, if you look at a medical textbook and look how many times a minute are we breathing, we're breathing 12 to 20 times a minute as a people. Why are we breathing more? Why are we breathing more with more frequency? For most of us who are studying all this, we think it's really a big part of our lifestyle. We are just really busy doing stuff all the time. And we keep ourselves in this heightened state of activity, okay? Now, maybe our airway problems are helping us stay in this heightened state of activity, and we're not getting into this relaxed state, okay? Our body controls us automatically. There's a thing called the autonomic nervous system. That is the nervous system that we don't pay any attention, that runs everything, okay? We don't think about making our heart beat. We don't think about making our digestive stuff work, right? It just all happens, okay? And the autonomic nervous system is doing that. That deer we were talking about earlier, okay? That deer is in parasympathetic mode probably 99% of the time. The only thing that deer is worried about is eating and sleeping, getting some water, and once a year, it's interested in reproducing, okay? The rest of the time, the only other time that it's in that flight mode, that sympathetic mode, is when a human shows up or a predator shows up, and that deer goes, I got to get out of here, and it exits. And as soon as it's outdistanced its prey, it's like, oh, I outran it, back to eating, back to normal. So if we think back, I think if I go back 100 years ago, how was my grandpa, great-great-grandpa doing on the farm? And most of our parents were agriculture people back then, okay? We had to plant, we had to harvest, we had to watch the crops grow. We couldn't be doing 1,000 jobs. We had to maintain our farm. We had to raise our kids. We had to recruit our kids to help us work the farm animals and the crops and stuff. But there was a lot of time where we had to, was it all that stressful to be behind the horse plowing the field? I don't think so. It was like, okay, we're going to do another row. We're going to do 2 rows, and we got to let the horse rest. And what are you going to do while the horse is resting? You're going to do the same thing the deer's doing. You're just going to be waiting for the horse to get its wind back. We changed our farming technique to run a tractor. We can run the tractor 24 hours a day. That tractor never gets tired. So that farmer today has got added stress on him because he can be in the tractor seat all the time. Okay. Now with computers and stuff, they might be getting a little more relaxed because they can just let the GPS do the field work now. They just sit there and make sure the tractor isn't making funny silence,